Welcome back to the latest episode of Cracking the Code with Chris Bowen. So Chris Bowen is the founder and CISO of ClearDATA, the leading managed cloud and defense provider for healthcare organizations. And Chris, Senator Warner of Virginia recently published a paper titled Cybersecurity is Patient Safety. And we touched on it in the last Cracking the Code episode, and I know you've been briefed by his team on the policy options that the senator is proposing. And ClearData is submitting an official response with proposed policy options in order to support American healthcare cybersecurity. And the first question from Senator Warner's team is about HIPAA, specifically asking where are the gaps in HIPAA currently and how should it be expanded? So obviously it was passed in 1996. It's been around for now over 25 years. And in some senses, it's held up very well. Yet a lot of people in the industry still think there's ways for us to improve the law. What are your thoughts?
Yeah, first of all, I think Senator Warner and his staff have been very generous with their time, with briefing members of the healthcare community, with seeking input, with having just conversations about it. So good for them in producing this paper. If you haven't read it, please see the link in the window and go take a look at it. It's got some great ideas, some great questions that are very thought-provoking. And I'll also add that Senator Bill Frist, way back in 1996, when he was chairman of the Health Committee, he did a great job crafting HIPAA. And so I'll give my comments around HIPAA as it relates to the technical side of things, the HIPAA security rule, if you will. And the controls that are outlined really don't, at this point in time, in this age in our life cycle with HIPAA, they don't really provide the detail necessary for healthcare organizations to support and to secure themselves from cyber attacks. We don't have to look very far to understand that. Healthcare is under attack, things are behind, and there's just a lot of things that we could do to bolster this law. Now, there have been some other areas of legislation that we've talked about on this podcast before, which is really around, I believe it was HR 7898, which requires that you use best practices to secure your environments where you have PHI. But I think sometimes there needs to be a little bit more explicit type of guidance. And I'll give you an example. HIPAA includes a standard, it's addressable. It's a standard for encryption in flight, encryption at rest when data is not being used, and it does, as I mentioned, call out that it's addressable. Back in the day, encryption was kind of a big deal. It was tough to implement. It had performance hits, and so they made it addressable because you could certainly cordon off data in a way that was less risky and you could get away with not having encryption. Nowadays, everybody should have encryption. It's really not, it's a no-brainer at this point. The area that lacks here in the HIPAA security rule, though, is key management. It has nothing to say about key management. That's one of the basics that we could add some color to, some flavor to, some prescriptive guidance, if you will. So key management is one of those areas around the encryption. There are more examples that we could go into, but for time's sake, we'll move on to the next one. But that's one of the really important ones for sure.
Right. And yeah, and I agree. I don't think it gets enough attention in the discourse. And the next topic that is shouted out in the paper that ClearData is responding to is student loan forgiveness for professionals that perform cybersecurity services in the healthcare sector. So I'm curious to get your thoughts. What's the best way the government and our industry can approach this initiative to build out long-term defenses of healthcare?
You know, I'm all for loan repayment forgiveness if you can show that you've contributed something back. And I think, especially in our rural healthcare environments where we have critical access hospitals and hospitals that are sorely underfunded, I think it's a great idea to have some kind of a public service program that allows an individual who has studied cybersecurity to go in and give back to the community, give back to society by lending their skills that they've learned, admittedly, probably using a lot of private resources, private funds, but probably also some loans that they've been subsidized by the federal government, give back by working at some of these organizations, helping them address some of the cyber challenges that they have. These could be via college or university or certification programs. These could be investments that are made on cybersecurity areas that are most in need by certain covered entities and in some cases business associates. It's all really to support more individuals to gain access and financial support to help us address this massive cyber talent shortage that we've got. So I'm totally in favor of that. I think it's a great proposal. I think it's something we should really think hard about and provide the resources to do.
I agree. It definitely is a great initiative. And just to push back on it, like if we're approaching this with the modern political climate, it's a contested issue, right? Loan forgiveness. You see articles in the news every day about President Biden's loan forgiveness programs. Is this one of those initiatives that we need to prioritize above the other policy options in the paper? Or is it something we should probably try to tackle later on just because it might be too difficult politically to pass this through?
Yeah, I mean, the three branches of government, the fourth if you count the press, they're designed to stop things from happening from a policy perspective. That's the nature of the structure of our government. I'm glad you didn't pull me into the political debate. It's a fascinating thing to talk about. I'm from Arizona, and as you know, our senior senator Kirsten Sinema switched to the Independent Party. So there's a lot of political discussion happening right now. But I do think we should give back something if we're going to get a loan forgiveness program. You shouldn't just say, here's a magic wand, and you may not have contributed anything. You may have gone back and said, hey, I've got this great education now, and I'm not going to do anything with it, and still I got my loan forgiven. I don't believe in it. I think you should get on the wagon and help push it, if you will, and do your share. To quote one of our famous Texas senators from a while ago, Phil Graham, everybody's got to pull their fair share of the wagon, is my opinion.
Absolutely. And another proposal that has gotten a lot of attention is the healthcare sector expecting greater support from the federal government with cyber insurance. So we're seeing small healthcare providers at some points being attacked by nation states, right? With nearly unlimited budgets and forced to bear on these very small institutions. Senator Warner's team asked the question, should Congress create a reinsurance program or otherwise regulate cyber insurance? What are your thoughts?
Wow, this one's close to my heart because I lead our cyber insurance renewal process every single year, and it's painful, and many times our insurers will not necessarily understand what they're asking, especially when it comes to the advanced technologies around cloud and some of these other areas. And it's really, really expensive, prohibitively so. Healthcare providers and those that need the insurance usually can't afford it. And so what happens is there's a shortage in coverage. There's a gap in the amount of potential liability coverage from an insurance perspective and what you actually need. And so organizations are now having to self-insure the gap there. Now, that may not be a terrible thing. It certainly incents the organization to practice sound cyber hygiene and operational hygiene. But in many cases, you'll see insurance policies that have carve-outs that don't actually pay for attacks by nation states. You'll see carve-outs that say, hey, we're not going to cover any kind of criminal syndicate if they're associated with a nation state actor. And so what happens is, regardless of how much money the healthcare organization has paid, if there's that carve-out, you're out of luck, even though you paid a lot of money. So make sure you read your insurance policies before you bind them, etc. And, it's just the gaps in coverage, the expense, the fact that you have nation states attacking healthcare. That should be really the job of the federal government to help protect critical infrastructure. I won't even mention today the failure that we've learned about by the FBI's InfraGard portal, which is the critical infrastructure intelligence portal. I'll save that for another day, Ryan. But we're not doing a great job of protecting our critical infrastructure. In fact, I likened it to the Saturday Night Live skit where Peyton Manning was playing football with the young kids, and he was acting like an NFL quarterback. And I likened, some of our federal partners as the kids, trying to catch that ball from Peyton Manning. Peyton Manning playing the part of the cyber criminal in my mind. It's just ridiculous. We've got to do a better job. We've got to do a much more thorough job, and really we got to focus on this and do what we've been preaching all along, and that is practice sound operational hygiene. Do the pen tests on the portals. Don't skip your process. For example, we could go into more of that in the next episode, but there's a lot we can do to protect our organizations.
Absolutely. It definitely seems like, I don't know, people have always been very focused on physical, real world threats. And now like people are finally coming around to just the reality of how damaging and vicious cyber attacks can be. But clearly, we still have a long way to go. So as we close out this episode, I'm curious to get your thoughts. Of course, we'll link to, our policy responses as well as Senator Warner's paper here at the end, but I'm curious if you have any closing thoughts before we sign off this episode.
I just think if you focus on the basics, focus on patching, focus on making sure that you're not using end-of-life software, do your phishing training exercises, your phishing simulations, do your breach simulations, your incident response simulations, clean up the clutter, the mess that's part of every organization's cyber and security practice. It's also incumbent upon IT and those that are in charge of the technical assets in an organization, specifically in healthcare, to mind the sheep, if you will. Make sure that the servers are doing what they're supposed to do. Make sure you look in on what should happen on a day-to-day basis, on a quarterly basis, on a monthly basis, etc. And just practice operational hygiene. This is not rocket science. Well, actually, sometimes it is rocket science, but there's a lot you can do without having to employ, hundreds of thousands of dollars worth of resources to come in and clean up a cyber program. You know what to do. Do it. I challenge all of our healthcare partners to do what they need to do on the cyber and the operational hygiene. It's really, really important.
Absolutely. Yep. It's one of those areas we can never really do enough, and we can't delay anymore. There's just too much at stake. And that's always been the driving force for ClearData, is that data is life in this industry. So really appreciate your time today, sir. And thank you to our viewers for tuning in. And we'll be back next month for first episode of 2023.
Can't believe it already. Thanks, Brian.
Cool. Thank you. Bye-bye.